I'm Brian McCrindle. I'm one of the co-chairs here at the 11th International Kawasaki Disease Symposium with my co-chair Ann Rowley. And we have Jane Newburger from Boston and Jane Burns from San Diego, who are key components to this meeting. They have the job at the end of the meeting of summarizing days and days worth of science. So start off by asking Jane, what were some of your key points you picked up at this meeting?
I think we were all amazed and dismayed maybe at the incredible increase in the number of cases in Japan. I think that Japan clearly has the greatest case ascertainment counting ability of all the countries that were represented here. And I suspect that there are increasing numbers in other countries as well, but Japan has really set the standard, and so the attack rate is increasing such that now it's up to almost 300 cases per 100,000 children less than 5 years of age. So if anybody thought this disease was going away, I think we have decades and decades left to study it with the increasing numbers. So the other takeaway lesson from this is in terms of resource allocation. In India, a country that we would normally associate with rheumatic fever in terms of acquired heart disease, the researchers there are convinced that, at least at the major academic centers, that Kawasaki disease outnumbers rheumatic fever 10 to 1. So we're going to be dealing with this in emerging countries and, of course, needing more data from both India and China that account for a third of the world's population.
So Dr. Kawasaki, in our interview with him, mentioned that his #1 priority was we really need to discover the etiology, that we don't have any hope of preventing this disease until we know what the etiology is going to be. Could I get your thoughts as, are we getting close?
The quality of the science that's being applied to try to answer that question at this meeting was certainly way over and above, I think, what we've seen in the past, and largely Ann's collaborations and the amazing work of virus hunting or sequence hunting was top-notch science, a really daunting prospect. The other avenue that was new or newish at this meeting was the microbiome story. And I think that that's been most aggressively pursued in the animal models, which may help us to understand, but that more needs to be done in terms of microbiome work in the patients. If it's not going to uncover an etiology, it might at least inform us about modifying factors that determine outcomes, severity of disease, or impact other responses of the host to whatever this trigger is. So I think the quality of the science has really improved steadily over the years, and that's hopeful. But I think we still
have a ways to go.
A long ways.
What would you say about the new genetic information at the meeting? How would you summarize that?
The genetic information for me is really coalescing into pathways. And I think the excitement about that is it gives us an avenue towards translation, and I think Jane is really going to talk about that. But I think that the genetics, we all realized at the beginning, is not an end in of itself. It's a means to an end. And I actually think that Kawasaki disease is kind of a poster child for translationability of genetic data really rapidly into ideas for new therapies. So Jane, maybe you want to talk about how that axis is going.
I think this meeting has been remarkable for taking us from molecular biology and transcription profiling to animal experiments to new therapies, such as if you look at the IL-1 expression story, you see it at a molecular level in patients' material. You see it working or expressed in animal models, and now there are anakinra trials. So we're going from bench to bedside. I think a similar story can be made for statin trials, where there is molecular animal model and now just very early human studies that are beginning.
So one of the unique features about our meeting is that we have an engagement with families and the parents, and I wonder if I could get your thoughts on how that works for us.
Well, first of all, we're all really grateful for the support of the KD Foundation. And the parents are very engaged in these research questions. And through PCORI, they're actually being engaged in a voting process to try to have input into what research priorities should be for Kawasaki disease. So I think we're all really proud of the way that we have engaged the parents as stakeholders in what our research priorities should be, and they will be actively engaged in deciding some of that, because that, after all, is the purpose of what this interview process is all about. But
and wouldn't you say that most Kawasaki researchers are driven by their interactions with the patients and families, so it's a kind of a logical thing to have them here with us at the meeting, since they kind of stimulate most of us to do work on this disease.
they definitely are our inspiration.
Mm-hmm.
So one of the things that parents and patients bring up is sort of questions around what's my long-term prognosis, what do I have to look forward into the future? Jane, is there any information at this meeting that's helped to illuminate that?
There have been a number of really excellent presentations from single-center data and increasingly multi-center networks that are attempting to both get large enough numbers and to prospectively follow patients. What we don't have in North America, and even in Japan, there's a limited amount of data on 30, 40-year follow-up. So we know that patients with very big aneurysms have a very high risk early on, and then that risk is relatively managed after 2-3 years by the kinds of procedures that we do with patients. But we really don't know 40 years from now, when those children are going to be in the purview of the adult cardiologist, how individuals with medium-sized aneurysms, not the very biggest ones, how they fare, and also how patients with giant aneurysms do when they are in middle age. And I know we're going to be gathering those data with the infrastructure that's being put in place with multi-center registries.
So it seems like each symposium answers some questions but raises many more questions. And I think with that we'll conclude, and we're all looking forward to Dr. Kawasaki's birthday today.
That's right.
90 years old.
Our fearless leader.